I think it's wonderful to see three world-class leaders from three world-class companies look to see how they can innovate and disrupt an antiquated healthcare system.
You believe this is really being done to solve problems in-house, or are they going to export this for everyone to use somehow?
Well, my sense is, and I'm only speculating, is that they're looking at their own healthcare costs. They're all large employers and saying, how do we manage this better? And if the net result of that is lower costs for their employees that then can be exported as a model to other employers, both large and small, I think that's good news.
Brent, Jim, good that you called in. Thank you so much.
Oh, sure, Jim.
Curious about how the ability to put together a buying group this very big. I mean, these are very big companies, lots of employees. Can they be a powerful enough buying group that they can go right to Allergan and say, listen, you got a new migraine drug coming, and we're only willing to pay X. And you could say, well, look, that's, we got to go through a distributor or whatever. And they say, no, Brent, you've pledged to cut costs. We're coming to you directly. Give us a break. Can that happen?
I think it could, but that happens today. That is the role of the PBMs, right? Those are the discounts and rebates that we provide to PBMs, is the aggregation of employers to group discounts. Whether they can do it better, maybe they can, and that would be a positive for employees and ultimately patients, right?
Well, Brent, how can they not do it better if they're not taking a profit? I mean, Express Scripts, ABC, I mean, these companies are profit-making entities.
Yes, that's right. So if they do it that way, I think that's right. The question is, do they have enough scale? And it certainly appears that they do.
Well, so Brent, it's David. Give me so you read this release like we all did. I would assume you haven't had a chance. I don't know. Have you talked to Bezos or Dimon or anybody else associated with this effort? Or are you sort of, I've made a couple of calls and talked to a couple of people, but are you just guessing here in terms of what you expect it will become?
Yeah, I'm just speculating. I haven't spoken to any of them. I will reach out to them, but I do think it's a positive for all innovators, right? We as a biopharmaceutical company are an innovator, and I think it's time that we saw more innovation in the provision of healthcare, right? Services and the management of chronic disease. And the key is in this case, you put the patient, which is in their case the employee, at the center of it, and you try to bring down costs. It's certainly right for disruption.
How would you, all right, so you're starting this new company, it's not for profit. How would you go about doing it if you were in their shoes in terms of first steps?
Yeah, I think, if you look at they represent, let's say, close to 1 million or perhaps 1 million or more employees classification in the United States. My sense is the main driver of their costs are chronic disease, whether that be diabetes or complications due to obesity and the like, or heart disease and things of that nature. I would look at how do we better manage those diseases? What incentives can we put in place to appropriately share the burden with the patient and drive better outcomes? And I think if they do that, they're going to drive costs down.
Brent, what kind of person would you make CEO of this? Would you go outside the government? Would you go outside the industry? Would you get someone who's retired from the industry? Because this CEO could be as important as the head of the VA. Honestly, another buying group that's very big and just demand certain things and demand a level of technology. Who would be an ideal CEO?
Yeah, it's a good question. You could go after someone, who's very experienced and very knowledgeable, like a Toby Cosgrove from Cleveland Clinic, who I think just recently retired. But, maybe you need to go after someone who's a disruptor, right? Someone from inside of an Amazon or here that has disrupted industries before. Amazon certainly has probably the most experience in that. There's so many experienced people in healthcare, Jim, but it's easy to fall into the trap of this is how we've always done it. Maybe we need some fresh thinking.
Wow.
One last question, Brent. Would you expect or want the government to have anything to do with this?
I don't think the government is necessarily the best for disruption. And certainly they haven't been the best at providing private market solutions. I think they'd be best watching this group and learning from them. And certainly, I would love to help them. I'd love for Allergan to contribute, and we'd love to be part of the solution. And I'll reach out to them to see if we can help.
Yeah. Thanks for helping us make sense of it on these early days.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.